Garima Verma, also known as your Dr. Scrubs on Instagram. And so today we have our very own Dr. Arunika Thakur, who is my UG batchmate too, and she's currently pursuing MD Internal Medicine from Dr RPGMC Tanda. So hi Dr. Arunika, how are you?
Hi Garima, I'm good. I hope you're too.
Yeah, yes.
And
So
it's so nice to finally be able to do this.
yeah, seriously, believe me, I've been talking to so many residents now, and to get one of you to the meeting is like a task. And thank you for taking out time for this session, and I'm so grateful that you're here. So, just tell me a little bit about yourself, like how is residency life treating you?
Okay, so uh, it's been overwhelming at times. It's been awful at times. So it's been a mixed journey so far.
Hmm.
But it is supposed to be harsh. It's not supposed to be pleasant in the at least in the first year of residency. So that's what it's making me, just taking the brunt of it. But I think मतलब जब juniors आ जाएंगे so it might get better, and we will be able to actually practice medicine and study, get involved more into the academics. Right now it's slightly on the harsher side, and it's exhaustion is real right now.
So, how does a day in your life look like, and like what is the work that you do in the hospital, and when do you report, and everything? We want to know everything about your life, like professional life.
It's like any other residency. You're supposed to be there for most of the time in the hospital, working in the department.
Hmm.
Okay, your personal life takes a back seat.
Hmm.
But it's like the day starts at around. You have to be there at 8. You have to do all the ward work and just prepare everything for the rounds. You have to know the patient status. You have to correct whatever you can before the round begins, and you have to present it to the consultant. Before that, a pre-round happens to the senior resident, and you have to make sure that everything is perfect, and you know yourself about the patient too, for the rounds to present uh, yourself in front of the attending the rounds. And after that, whatever the consultant tells you during the round, you have to make sure it gets done subsequently. And also you can add your own input, also contribute to the patient's management. In meantime, you have to you since you're the junior most batch, you have to assist your seniors also, whatever they're doing. And you have to make sure that you're following whatever they're saying. And there are some PG activities also. You have to present some journals. You have to also make seminars and present some cases. So all that takes a huge time of the day. And yeah, and also when there's an admission day, you have to be there for the OPD, and at night you have to be there, or sometimes during the day you have to be there for the casualty,
Okay.
which is the most tedious part. Like, you have to be on your toes, and casualty can be like really scary, where there's like, you have to first do the triage of patients, and then you have to whatever emergency management you can do, you have to do that. And just henceforth take the action, whether to admit the patient to the ICU, or to the ward, or send him back home. So all this takes up your mind all day.
Yeah.
And and you never really know what else is going on in the world.
Yeah. So, why did you choose this branch and the college that you are in?
Okay, Garima, so you have known me over the years, and you know that I really like medicine since a long time, and I have grown fondness for the subject right from the second year. Like, even in first year, I hated anatomy. I was not very academically oriented, but I used to hate anatomy. So I had made up my mind back then that I am not made for a surgical branch.
Right.
I might end up being a terrible surgeon, because anatomy used to clog my mind up. And then second year, when I started to study a little bit more pharma and patho, I just grew a little fascination for them. and
Yes.
and then third year happened, where you and I joined DAMS, and
Yes.
where we started to started to study the final year subjects.
Yes. And
And
then first
where we
subject that we read was medicine, right?
the first subject, the first class I remember we read was of medicine, and I remember just just sitting up straight for 4 hours
4 hours
long,
and
and
studying medicine.
that will fire me up.
Yeah, yeah. So medicine from DAMS was amazing. Like in a recent post, I told everybody about DAMS medicine, like how amazing the sir has told us. Arvind sir class it was na, satellite classes mein.
Yeah,
Yeah.
yeah, gas.
Yes.
Yeah,
Yes.
so and from then onwards I started studying very sincerely, and
Yes. We
even in
remember.
like third year, I just developed a huge fascination for the subject, and
Yes.
then subsequently, final year, and now
And
finally landed up.
why the college that you are in?
And the college, because it's really close to my hometown, right? As as most people around me know, that I'm a day scholar. I practically live in the hospital, but when not, I come home for sleeping. And yeah, so Tanda medicine was always my first choice,
Yes, we
be
all
it in
know
state
that.
counseling, be it in India counseling.
Yes, yes, we all
And
know that. Transition from MBBS to MD.
as you already know that MBBS, we were not exposed to a very huge patient load in our MBBS days. So the transition was not that hands-on.
Hmm.
Like, okay, it was little overbearing because the patient load was way different
Is
in the
different in a
college that
government
I was.
hospital. Yeah, correct. Correct.
Yeah, so it is way different. Like you cannot sit for more than 5 minutes in an emergency, in a casualty, because
Correct.
the
Correct.
patient just keep on coming.
Yeah.
So it's a huge transition,
Hmm.
and also in the MBBS time, you're very well protected. You're just
And
treated as
relaxed,
kids.
and yeah, and you have no fear in UG, right? And now you have some fear in PG.
And yes, and the only thing you have to do is you just have to understand and study the subject. Here you're actually working. Nothing is passive. Everything is active.
Yeah.
It's active learning here.
बिल्कुल.
Okay, nobody is going to spoon feed you. You have to use your presence of mind to learn, learn the subject that you've chosen.
Yeah. So are you happy with the choice that you made? And if given an option to change the branch, would you do that?
Yes, I think I am happy because 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 even if it becomes difficult, I just keep reminding myself of the days that we were struggling with the counseling, that I really badly wanted medicine, and now when I have finally I am finally in one, I cannot just keep on complaining for too
Correct,
long.
correct.
So I mean, yes, and I would not have chosen any other subject, and I was one of I was fortunate enough to choose from all the subjects in the at least in the second round
Exactly,
of counseling.
exactly.
So no, so I had made my mind back up then, and I think pretty happy with this one.
Okay. So what do you have to say about MD versus DNB? Whether someone should prefer branch or college?
I think both of them would be empty degrees if you do not know the subject, and you
Correct,
do
correct.
not know the fine nuances about it. I mean, it really doesn't matter. But if you really like the subject, both of them are equivalent.
Yeah.
The only thing is that DNB in the pass out exam is much difficult,
Difficult, yeah.
and the passing out rate is also slightly lower as compared to MD.
But it
And
is now
DNB,
but now the passing rate is rising only, right? Especially in medicine
yeah, it
and
is rising.
OBGYN surgery that I have seen. है ना?
Yeah, it is rising. Yeah, that's for sure. But also another thing is that DNB in some hospitals like Gangaram, they are like
Is top
it's
notch.
really considered that's top notch. And in government colleges, you really have to worry about small ground level things like
Yeah.
sampling and everything.
Yes,
There
everything.
you do not have
Yeah,
to worry
there is a
about these
set
things.
protocol what a resident has to do, right?
Yeah, resident doesn't have to worry about all these things. Sisters take care of that. Here you only have to
Do every scut work and
worry about it.
everything, right? In MD
Yeah,
government
yeah.
hospital. Yeah.
Yeah, here you only have to worry about the management of the patient, the only thing that is concerning you,
Yeah.
and your academics.
So if
Yeah, but in
somebody
government.
So if somebody wants general medicine and he's not getting MD but he's getting DNB in a very good institute, so should he take that?
I think you should, because as far as I have known myself and my fondness for the subject, my first choice was medicine, and I would not be happier in any other branch.
Yes.
So any general medicine aspirant would be equally happy in
DNB
pursuing
also.
in a residency also, and there is not much difference. It can be actually better
Yeah.
also. So I don't think so.
You get any time for yourself, especially in a first year residency, and is there any toxicity in your department?
Uh, I mean, sometimes we do get like when there's a day off, you have to go there for the rounds, and if you have a less patient load, you can be free before I would say like 2 or 3, so you can have the evening for yourself.
Okay.
But that doesn't happen too often.
Yeah.
And regarding toxicity, I don't think so there is too much toxicity in medical departments.
Okay. So you that means your department is very friendly, like, so there's
It
no
is very
toxicity in your department, in your college, maybe.
yeah but Yeah, but but there's a thing that is like exhaustion is very real in medicine.
Yes.
So that does make people cranky, and that may not be a bad person by nature,
Okay.
but anything that is not getting done, caring about little things like getting a test done, or getting a test not done, can make anybody
Cranky.
annoyed and
Yes, yes.
cranky. Yeah, so
Agree. I
that
agree with you. So, are there any procedures that you do, and like what all procedures that you are doing right now?
Yeah, we do a lot of procedures. So I remember, in the first week of my residency, procedures like pleural tap, ascitic tap, and and like procedures like these were very common.
Okay.
Like any person, even an intern was made taught how to do these things, and we do these things on a daily basis.
Yes.
And also by another 2 months, we learned how to do a lumbar puncture.
Okay. Okay.
Okay.
So,
Some of us even learned it a bit earlier.
okay. So, any specific tips for somebody who is waiting for counseling and is interested in general medicine? Like, are there any tips that you would like to give?
Okay, so my first tip would be that you should utilize this time sleeping, and and doing things whatever you can do right now, because you might not be able to do them once you enter your residency, at least in the first year.
Exactly.
And counseling is it requires a lot of patience, and it requires a lot of smart work.
Yes.
So while you are so whatever you should make up your mind, whatever which branch are you interested in, and which college you would be interested in, and you should prioritize the list, and you should fill your choices very carefully.
Okay, carefully. Okay, so what was your mindset before you joined residency, and is there any preparation required before entering a college in PG?
uh, so my mindset, I was during the counseling time, I was really anxious, because because it was an uncertain period.
Yeah.
Like
I
you know
remember talking to you and you were like, यार जल्दी counseling कराओ यार मुझसे नहीं हो रहा.
yeah, because things change every year. Things keep on changing every year. The structure of the counseling, the seats, everything changes. So you're
Yeah.
not really, even if you're getting a decent rank, you're not really sure whatever
Whether
you'll,
you'll get a seat or not. Yeah, correct. I completely
in
agree.
your desired,
Yeah.
in your desired college.
Yeah.
So that was really making me very anxious, that whether I'll be able to get medicine or not. If I'm getting it, okay, that's very good then. But if I'm not getting it, will I be able to live with another branch for the rest of my
Yes,
life?
yes. So it is a
So
very uncertain period.
yeah, so I was struggling with these thoughts during the counseling period. But once I got the allotment letter, okay, so all and once I joined the residency, and the first day in my residency, I just saw the ward, and I was like, oh my god, this is what I have to do, and this is what I was having patiently waiting for, because it was a lot. It was a lot to
It was.
see in one day. I mean, the
Exactly.
patient load, but and it kept on increasing. I mean, the first 1 month, every day was like a new challenge. I was taking it like a one day at a time, but now I'm a little bit more settled, and
Yeah, you just get
learning.
the hang of it. Like with every passing second, you just get better and better if you are there to learn, right?
Yeah, and also you learn everything. You learn something or the other each day,
Yeah,
whether or
correct,
not it is
correct.
not, whether or not it is related to the academics or people
Just, just,
management.
just the way of life, maybe, right?
Yeah, just the way of life.
Yeah. So last question from my side. When you were preparing for NEET PG, who was your favorite faculty and why?
Okay, so my favorite faculty has to be Dr. Rakesh
I
from
knew you
Marrow.
will say Dr. Rakesh because I love him from the core. He's the god of medicine.
He is the god of medicine.
Yeah.
I mean, he's a nephrologist and he's a super specialist, but
Yes.
he seems to have the
Every
grasp of whole of
of
medicine.
everything, yeah, correct. Like I remember his voice literally echoes in your ear when you are giving an exam. Like कि ये राकेश सर ने बताया था ऐसे होगा, नो इसको ऐसे twist करके सोचो. I remember it.
Yeah, and I mean, it's like simply like when it comes to any faculty, Dr. Rakesh, his name just comes up in my mind without any second thought.
Yes, yes, yes. And any other faculty that you liked?
And also other faculties like Dr. Arvind, as we said earlier,
Yeah.
DAMS medicine, and also Dr. Achin. He taught
He
neurology
taught
so well.
so
I
well,
mean,
like so well, and his notes were very structured. I still remember, like I read from Dr. Rakesh too, na, but when it came to revising the subject, na, I used my old DAMS note and revised that because it was very structured and very concise, right?
yeah, and like it was a cakewalk to study neurology.
Yes,
Even I
yes.
thought I would never be able to understand neurology,
But yeah,
but in
yes.
third year, in third year itself, he just made it so
So
understandable, and it
understandable and
just
so easy. Like we knew ki where's the lesion, like how to localize a stroke and everything. Like we have read it and we loved it. Achin sir classes, I remember we both attending that and looking it like this.
yeah, and I just those 4 hours just felt like 20 minutes
Yeah,
because
yes,
those classes were really amazing.
yes, I
And
agree.
also Dr. Deepti and Dr. Sakshi ma'am for teaching OBGY, and because they are, these subjects are, they contribute to the exam so
Exam so
much,
much,
and
correct.
being taught by such great teachers, and they teach it so well that
Yes,
it becomes such a, it becomes, it's like a cakewalk
correct.
to crack those questions for the exam. And even I remember final year viva, everything was from the notes of
Yes, from
Dr. Deepti
notes.
and Dr.
Exactly,
Sakshi.
exactly. Is there any favorite faculty from our UG college that you liked, loved?
Yeah, I would say remember Dr. Sami from pharmacology.
Yes, I
Yeah,
remember.
because
And
he
he
taught.
left after we passed second prof.
Yeah, and he, before leaving, he made sure that he taught all the
All the,
important
yes,
topics,
yes, yes,
and which are still etched in my memories. Whatever he taught, like
yes. He
ANS
taught
and PPS
pharmacology
and
in a amazingly fashion. Yes,
Mm, I could not believe that somebody, in a medical college could teach us like
yes,
a
yes,
school kid, you know.
yes, yes,
And also Dr. S.S. Kaushal used to take our clinical classes so well. And even though he did not teach us for a very long time,
yes,
and he did not take too many classes because of the COVID,
yes.
but yeah, I'm really fond of these two people in the
Okay.
college.
Okay, so thank you for time and thank you for everything. Thank you for taking out time for us and guiding us and telling us what a medicine residency in first year looks like. So, best